Good afternoon, Minnesota, and thank you for joining us. Since we've been doing this for about the last 4 months, and I think now as we've come to understand the impact that COVID-19 has had on both us as a state and nation and globally, probably nothing in any of our lifetimes has been more disruptive. We have almost 150,000 of our fellow Americans dead, nearly 4 million infected. The rate of acceleration to get to that first million took a couple months, and then it took about another month to get to 2 million, and about 3 weeks to get to 3 million, and 2 weeks to get to 4 million, that these are the way pandemics work. And from the beginning, Minnesota, we said we knew this was going to be a long haul. We said in March that the darker days were ahead of us, and we promised a few things. We said we would use science and we would adjust as the science and the situation warrants us to do so. We continue to say that the health, the safety, and the well-being of Minnesotans was paramount. We understood that we were going to be balancing public health, individual health, and economic viability at the same time. We watched it burn through other countries, and here in the United States, unfortunately, we did not prepare necessarily the way we should have in terms of PPE and forms of testing. In Minnesota, we said from the beginning, we were building for the long haul. We did not know if this would be a year, 18 months, or what it would take. We knew that the advent of a vaccine would be critical, and we knew that the longer we built time before people got infected, we would not overwhelm our healthcare system, and we would get better with the therapeutics. And I think that is starting to play out, that even as we start to see increasing numbers, we see fewer hospitalizations and even fewer ICUs, and we've been able to drop that critical metric number of people who are killed by COVID-19. And in following that science, we know it hasn't always been easy. It's been incredibly difficult across the country. The economic challenges that have been put to people, the changes in daily life, the missed graduations, the missed weddings, the not being able, as the Lieutenant Governor said, to hug grandma. That has happened, and it has exacerbated mental health anguish. We are struggling with and figuring out, and we know we have to get our kids back in school. It's the safest and the best place for them to be able to grow as people, and we need to make sure that that safety extends to their physical health. And so amongst all those things, we've taken measures throughout the time to try and slow the spread of COVID, to try and purchase the things that were necessary, to try and change behaviors in a way that would keep Minnesotans safe. And today we're here to announce another one of those. We're going to announce Executive Order 2081 that will be a Minnesotans must wear a mask indoors, a masking mandate. Now I want to back up for a second on this. Yesterday, President Trump said the worst is yet to come on COVID-19. Pretty ominous, but I think for many of us, a statement that we made in March. I don't think the president's probably wrong as far as the country goes, but I think here in Minnesota, with this mask mandate and with the things that we have done previously to this, I think it is very possible for us to not have the darker days behind us, but for us to start moving forward. If we can get a 90 to 95% compliance, which we've seen the science shows, we can reduce the infection rates dramatically, which slows that spread and breaks that chain. And this is the way, the cheapest, the most effective way for us to open up our businesses, for us to get our kids back in school, for us to keep our grandparents healthy, and for us to get back that life that we all miss so much. We know that the three most critical things in slowing the transmission of COVID and keeping people safe is wearing a mask, washing your hands, and social distancing. The good news is those cost us almost nothing. And as we've seen across the country, businesses have led on this, local localities, and I want to thank those city councils and those mayors and those communities out there that had these debates and moved forward. We try and will continue to try to build the coalition necessary to make these types of steps just the way we do business. I think many of us remember when we moved to no smoking indoors. That battle waged for a while, and then it became the norm. Wearing seatbelts. Most recently, hands-free driving. Asking you not to use your cell phone and having a penalty involved if you should choose to do so, not to take away your freedom, but to protect your neighbor from you running into them or you killing yourself by being distracted driving. The mask mandate works the same way. We're going to have Commissioner Malcolm and Commissioner Grove explain some of the details around this, but this is a very simple one. This is one if Minnesotans choose to wear the masks. And just to be clear, we've got an effort to get out about 4 million masks to the Chamber of Commerce across the state, disposable masks. We'll make this easy for you. We'll make sure that the police are there and they have masks on hand. They would much rather give you a mask and have you wear it than give you a ticket. Because in the long run, this is the quickest way to ending the COVID pandemic. It is the surest way to getting us to the therapeutics and the vaccines with the least amount of impact on Minnesotans. And it is the absolute economic key to making sure that businesses are open and stay open. So this is a move that you'll hear the details about that go into effect on Saturday morning. You certainly can start today for that percentage of you, and it is a minority percentage that hasn't been wearing them into places. We'll certainly start on that today, and the sooner we do that, the quicker we'll start to see the numbers go down. The quicker we do that, we'll start to see businesses be able to open back up and stay open. And as I promised and asked and said that we would do, we would try and adjust as the situation adjusts, and our goal is to watch and be smart about strategic openings, all with the goal of not having to go backwards. And this mask mandate should ensure that we don't have to do that. And we continue to look forward on the things that we can reopen and re-engage in the social life that we want to see. So with that, I'd like to have Lieutenant Governor Flanagan say a few words.
Thank you, Governor, and thank you, everyone, so much for being here. Our world changed dramatically about 5 months ago, and the crisis that we have faced has been certainly the most difficult of my lifetime, and certainly for many folks across the state and country. But I've also been incredibly moved by the acts of compassion and community and kindness. From donating over 7,000 homemade masks back in April, to taking to the streets to demand justice for George Floyd, to the thousands of hours and dollars that have gone towards the most vulnerable folks in our state during this time. That's who Minnesotans are. We have struggled together, we have learned together, and we have grown together. And among the things that we have learned is that homemade masks, while not a replacement for personal protective equipment, is one of the best ways that we can keep ourselves and other people safe. Masking limits the spread of COVID-19, and my mask protects you, your mask protects me, and when we both wear them, it keeps both of us that much safer. Today's announcement is the best thing that we can do to make public places safe all across the state. It's how we keep businesses open, it's how we socialize safety, and it's how we embrace a new normal in this moment. But above all, we do this because it will help save lives. 4 months ago yesterday, I lost my brother, Ron Golden, to complications from COVID-19. He had recently started treatment for cancer, and his immune system was compromised. To some, he was a statistic, the second person in the state of Tennessee to die from COVID-19. But to me, he was my big brother. And I share this with you today because the masking requirement, of course, will be an adjustment to towns and cities and counties across the state. But I share this with you because I want you to know how seriously we take this issue. In these towns and cities and counties that a masking requirement, has not, in these towns and cities and counties across the state where folks maybe haven't yet experienced COVID-19, that's where this masking requirement becomes even more important, so that the spread doesn't even begin in the first place, to prevent 1 or 2 cases from becoming dozens, and to prevent dozens from becoming deaths. Despite all we have learned, the virus is still unpredictable. We do not know yet what the long-term effects are. We cannot predict who may require hospitalization or ICU care. We do not have consistently effective treatments for those who fall seriously ill. The best thing that we can do to protect each other, especially those who are at high risk for severe complications and death, is from getting folks sick in the first place by wearing masks. I miss my brother every day. and we have not yet had the opportunity to come together to memorialize my brother. I pick up the phone regularly to send him a text or a cute photo of his niece, and then I remember that he's gone. So every death that we prevent is another family, another community that does not have to experience this kind of grief. I just want to be clear that we're not introducing this mask mandate to be a drag, or for some folks who may be separated politically on different sides of the aisle. I don't care what your background is, your political affiliation, your identity. I don't want your family to have to experience what my family has gone through. It's that simple. And wearing a mask is a way that we can do that together. Adjusting to wearing face masks may be a little uncomfortable, but you'll get used to it. They can be stylish and buffalo clad. But it's also a way that we just show as Minnesotans that we care about each other. And I think that that's something that we're good at. So I invite Minnesotans to learn more about how to wear masks effectively and to make sure that we are doing everything possible to make this work together. It's worth it. And with that, I'd like to hand it over to Commissioner Jan Malcolm.
Thank you, Lieutenant Governor, for your warm heart and reminding us about what's behind the statistics. It's lives, our families, our friends, ourselves, our state. So thank you for that. Thank you, Governor. This is another important step forward in our fight against COVID-19 in Minnesota. And we know that everybody's tired of this. Everybody's wants to be done with it and wants to get back to everything that we are missing and have missed, and to get back to normal. But as the governor and lieutenant governor have said many a time, it's going to be a new normal for quite a while, and we're going to be living with COVID-19 for quite some time to come. And wearing masks whenever we are not in our homes, whenever we are not just with our own household cohort, is one of the ways that we can best live with this together. I'm going to shorten up my remarks a little bit because we have some really important leaders in our community for you to hear from, but I do want to just share a little bit of the data with you and give you the high level of what is contained in the executive order. You know, until we have the weapons that the governor has talked about and the lieutenant governor, effective treatments and a vaccine, our best weapons against this are community mitigation and reliable information. A quick side note, we were gratified yesterday that Minnesota is on the right track when it comes to having the information that we need to fight this virus. An analysis by a national nonprofit headed by the former Centers for Disease Control Director, Tom Frieden, ranked Minnesota as the best among the 50 states in our reporting of key COVID-19 data. We know there's always more work to do to get the right data and to make it accessible to the public and to decision makers. And we will continue that work, but we were really gratified to see that the work we have done to date is validated and appreciated by national public health leaders. With regard to community mitigations, the governor said it, the big three, we know what they are: social distance, avoiding crowds, avoiding close sustained contact, hand hygiene, and masking. We can do this. We've learned so much more in the last few months, and we recognize that there were some mixed messages early on about whether masks worked or not, or in what situations they might be valuable, and who should wear them and who didn't need to. But we've learned so much more in just the last few months, and the evidence has really gotten compelling. We know how the virus is spread. We know that it can be transmitted much more than we thought at first, simply by normal speaking, much less loud speaking, singing, chanting, partying, the things you do when there's a lot of noise in the atmosphere or when it's part of the activity that you're doing. So masks help to control the spread of the virus through the droplets and the aerosols that literally come out of our mouths. The journal Health Affairs recently published a very thorough study that reported to what degree masks reduce the rate of spread of COVID in terms of cases and eventually deaths. And according to that publication, states that have mandated face masks have seen a greater decline in their daily growth rate. And these measures nationally are estimated to have already averted between 230,000 and 450,000 cases of COVID-19 to date by those who have worn masks either under mandate or voluntarily. At the end of June, Goldman Sachs shared an analysis projecting the amount by which further masking would slow COVID transmission and even save our country significant percentage points in GDP as compared to having to shut down the economy again to stop this tidal wave. Forbes just published an analysis comparing 21 states that had a form of mandatory mask policy with those that did not. The average increase in new COVID cases over the previous 14 days in those states with a mandatory mask policy was 16%. In states without a mask mandate, the average rise in new cases was 79%. There have been recent national estimates showing that whether we do or don't succeed in hitting that 95% public compliance with mask wearing between now and the end of the year could mean the difference in quadrupling the number of deaths that are projected in our country by the end of the year, whether we continue to socially distance and whether we wear masks. These are not trivial improvements in slowing down the rate of disease and ultimately death. And as the Lieutenant Governor said, we're doing this to protect each other. We've been saying for months now, I wear a mask to protect you, you wear a mask to protect me. Even for those among us who think we may not be at serious risk of illness, we have to remember that as many as 40% of all people with COVID-19 do not show obvious signs of illness during the time that they can transmit the virus, yet they still can pass that infection along to someone at higher risk. And no one wants to take that chance with a friend or a loved one. And while it's true that older people and people with existing underlying health conditions do tend to get much more severe disease, we've seen plenty of evidence in our own state that this disease can be deadly and very serious for younger people and for those without any known complications. And we're also learning now about very serious health consequences that emerge later on, months later in some cases, in people who had very mild cases of illness. So none of us should think that we are immune ourselves from severe consequences of COVID-19. But again, the key consideration here, because of the fact that so many people can spread this without knowing that they're infected, that is the reason that CDC says it's so important that masks be worn by everyone, essentially everyone, in public settings or when around others outside of their own immediate households. So and we've known, as the evidence has been growing, that this would be a good thing for people to do, and we've been strongly recommending that people use face coverings since April. But in recent weeks, as we've seen more of this evidence, as we've seen the results of the difference that mandating the mask makes, the governor has chosen to take this next step for Minnesota. As of Monday, 28 states, including Washington, D.C., plus Washington, D.C. and Puerto Rico, had implemented face coverings. I know a couple more just did today. More than a dozen cities in Minnesota have implemented this, including really all of the major population centers. But with today's order, the governor is extending this population to all Minnesotans and helping to create a consistent expectation for all of us, helping to normalize this critical behavior to live with COVID, as the Lieutenant Governor so eloquently said. So as of essentially midnight on Friday, Saturday morning at 12 a.m., Minnesotans must wear a face covering in indoor businesses and indoor public settings. Workers must also wear face coverings outdoors when it is not possible to maintain social distancing. The order is quite detailed. It lays out a number of specifics which are contained in the executive order itself and are also posted on the Stay Safe Minnesota website. And on the Health Department website, we have a frequently asked questions document, which is just going up. That details the circumstances under which mask wearing is mandatory versus when it is strongly suggested, when it's okay to remove the mask temporarily, and it also spells out who is exempt from this order, including people with certain medical conditions or people with some forms of physical and mental disabilities, as well as children under 5. So in order to be effective, a face covering must be worn in such a way that it covers the nose and the mouth completely. There's a wide range of types of masks that are effective, including paper or disposable, cloth, scarves, bandanas, neck gaiters, or religious face coverings. And there's plenty of guidance out there about where to get masks and how to make homemade masks. So we also, as I mentioned, there are a number of settings which are exempt from the governor's order, but may be subject to specific rules for those settings, specifically tribal nations, the judicial settings, and the like. The specifications around those with medical and mental health conditions or disabilities are laid out in the executive order. It's about really excluding people from this requirement who have conditions that compromise their ability to breathe. But in those cases, people are urged to consider alternatives to face coverings that might be suitable for them, including clear face shields and certainly, again, further limiting their contact with people outside of their home. For children 5 years old and under, those who are under 2 years old really should never wear face coverings due to their higher risk of suffocation and people not able to see what's happening with them. But it's a good idea, even though the exemption applies to under 5, for those above 2 to wear face coverings if they can as well. There are specific guidances that have been in place for preschool and pre-kindergarten and K-12, higher education, that are all spelled out in the guidance as well. So within the school and higher ed environments, there will be requirements there laid out for students, staff, and other people in those settings. But in the interest of time and to turn this over to other speakers, I will forego detailing those, but I do want to end by saying we appreciate very much that the statewide mask policy was a strong desire of many stakeholders. You'll hear from some, including the Minnesota disability community. And we want to thank the Council on Disability for their advocacy on this issue and to reaffirm our support and our commitment to our neighbors who are at risk and who have underlying medical complications. And I do want to acknowledge that cloth masks are a challenge for Minnesota's deaf and hard of hearing population, and that we ask everyone to be considerate and accommodating of our deaf and hard of hearing community. For example, having transparent face masks on hand or having alternate means of communication available, like note writing or video sign language, is a great accommodation that businesses and organizations can offer. With that, I will turn it over to my colleague, Commissioner Steve Grove.
Thank you, Jan. Governor, Lieutenant Governor. Hello, Minnesota. We have, of course, throughout the past several weeks, as we have been looking at the possibility of doing this mandate, really been heartened to see how many businesses have already taken this step themselves. We've seen large national chains based here in Minnesota like Target, Best Buy, Caribou, Cub Foods, all institute their own masking requirements on their own. In towns and cities across Minnesota, Coburn's in St. Cloud, the River Market in Stillwater, on and on and on. We've seen businesses take this step without government asking them to do it because they know how important it is to keep our economy open and to keep it thriving. Put simply, we've got to wear masks to keep our economy open and to pave the way to open it even further. And you know, the data really shows this too. A mandate's important. Goldman Sachs has looked at what the effect of mandates are on compliance with mask wearing, and they saw a 25% jump in mask wearing when a mandate existed. So this is a really important move we want to make, and it's an important economic one too. That same study showed that mask wearing can prevent up to a 5% GDP loss across our country when we avoid additional lockdown measures that would come if we were not wearing masks. So yes, this is an issue rooted in health, but it's really also rooted in growing our economy and allowing it to keep growing and to keep job growth moving in a very difficult time. As we've been examining this order and how to get it right, of course, we've been talking to hundreds of businesses across the state, labor groups, community organizations. We've been reviewing the policies of dozens of states and cities across the country. Just this week, Bemidji went forward with a policy. Egan last night, my hometown of Northfield last night, put a policy in place. So again, we at the state level are really following the lead of so many of our partners in business and communities across the state. And really good policies are based on some basic core principles. First of all, individuals are responsible for wearing masks. Second, businesses have to be a partner in that effort. Third, there's some really basic kind of common sense exceptions that you have to have in order to get this right. And then when it comes to enforcement, enforcement is really not the end goal. It's there to target flagrant offenders. The end goal is simply compliance. And so in putting this order together, we took all of that into consideration in writing this up. Commissioner Malcolm mentioned some of the basics. I'll go a bit further on some of this as it applies to business. Again, masking is required for workers indoors and in outdoor settings when they can't practice social distancing. That includes workers who may be out and about going into people's living units for business purposes, whether that's deliveries or repair work, etc. Customers need to wear masks indoors, or if you're waiting in line outdoors to go to an indoor facility. This includes public transportation, taxis, Ubers, and the like as well. Now, again, there's some common sense exceptions to all of this. So Commissioner Malcolm mentioned some of the health reasons. If there are reasons from a health consideration that you can't wear a mask, you do not need to do so. And if you tell a business that you are not wearing a mask for health reasons, that's where it ends. Businesses do not need to get into a conversation with you about your health background on that. Obviously, if you're eating or drinking at a restaurant, you don't have to wear a mask. We ask that you wear it into the facility. When you're engaging with your server, please wear it to protect that server, and use it when you're moving about the restaurant. But when you're just with your party eating or drinking, of course, you don't need to wear a mask. Same goes for if you're exercising at a gym, that kind of strenuous activity. When you're on that treadmill running, you don't got to wear a mask, but in those in-between times, have it on you. For workers, if you are engaged in strenuous work, you don't have to wear it, but again, keep it on you to use when you need. And then, of course, if you're working alone in an office or in a cube with walls high enough to prevent the spread, or if you're in a clearly separated area of work, a mask is not required. So just some basic common sense stuff the businesses told us needs to be in here to get this right. And really, this is something that in order to get right from an enforcement perspective, we have to partner with business. The interests are really aligned here. No business wants to be the next hot spot for COVID, the next COVID-19 transmission spot. That's bad for business. So we are collaborating with business to make sure it's just super clear what it means to be compliant if you are a business. First of all, it means you have to ensure all of your workers are masked, again, unless they meet some of those exceptions. You need to adjust your COVID-19 preparedness plan to include information around masking, so it's just really clear to both customers and workers what these requirements are. You got to post a sign, a clear sign where customers are coming into the business or where workers may come in, indicating that masks are required. We do have some signs available for download and printing on the Minnesota Stay Safe COVID-19 website. I'll be honest with you, I think the best signs are actually the homemade ones, the one the business makes themselves. It shows investment by the business there, but of course we did want to provide some if that's useful. And then there'll be instances in which a customer comes in and isn't wearing a mask. In that instance, we ask that businesses treat that customer in the same way that you would treat any challenging customer situation. Of course, asking them to wear a mask is important if that response, if they're not doing it for health reasons. Of course, as I said before, you leave it there. But beyond that, you engage that customer in the same way you would handle any other difficult customer in terms of mitigating the effect and ensuring that you can keep your business safe. If you do those things, you are compliant, and there are some further best practices in the executive order and in the FAQs online that will go into some of the things you can do to help mitigate some of the more challenging situations. Bottom line is we don't want businesses to have to feel like they're enforcing this as a sort of mask police out there. We don't want physical altercations on this. We want a thoughtful conversation and for it to be clear what the requirements are and for Minnesotans to do the right thing. One of the things the governor mentioned that we are really excited about is to make this transition a little bit easier on businesses. We are working with the Department of Administration. Commissioner Alice Roberts-Davis has been able to mobilize 4 million disposable masks that we are distributing through chambers of commerce throughout the state as early as this Friday. We thought it important to get some masks out into the hands of businesses because in tough economic times, no one wants to turn away a customer because they forgot their mask at home. And so these disposable masks will be available. We're working with chambers in all 88 counties of the state to disperse these. It's a one-time shipment. Again, it's just to kind of help get things started. But we hope an important aspect of this to make sure that businesses have a leg up as we begin this new order starting this Saturday. So again, we really believe this is an important economic move as much as it is a health move. This is an important part of paving the way for further reopenings. If we can get this right, get our indicators in a better place, we want to see more commerce happen in this state, and masks are just such a cheap and easy and simple and important way to get there. With that, I want to introduce a couple of business leaders who can share much more about how important this is for business. First, we're going to hear from Hannah Pura and then from Houston White. Hannah comes to us from Bemidji. She runs a gift shop up there called Compass Rose. In the summer of 2016, she opened up this gift shop, and she's done so much in her community to help individuals attack this pandemic and help other business owners too. And she's going to tell us a little bit more about why masking is important for her business up in Bemidji. Hannah.
Hi, Minnesota. So I've been asked by the governor's office to share my story and position on wearing masks in public. I'm here to speak on behalf of my small business. I'm not here to speak on behalf of other small businesses or any other industries. I just want to share my personal business story with you. So if we haven't met yet, my name is Hannah Pura. I'm the owner of Compass Rose, a home and gift shop located in the heart of Bemidji, Minnesota. In fact, Paul and Babe are just up the street from my shop. 4 years ago, I had a dream, I quit my day job, and I leaped into the adventure of being a small business owner. It sounds like it was a breeze, but it's been more like a beautiful storm. We've been in business for the past 4 years. We started as an online business with our warehouse being our guest bedroom at our house, and now we have over 2,500 square feet of retail space. Each year has come and gone with its challenges. However, this year has been different for everyone. Change is the only constant in life and in business, but this year the changes were greater than they've ever been. At the beginning of the year, we didn't know if we'd be able to keep our doors open long enough to welcome the tourist crowd that fills our town come May. It was scary. I couldn't pay my employee. I couldn't pay myself. Rent was late. Invoices were due. And then the COVID crisis hit. Our store was forced to shut down, and the panic set in. Luckily, our store manager's official title is Chaos Coordinator. So Kelly and I began to listen to our customers and see what they were asking, and then pivoted to meet our community's needs. This is the beauty and necessity of a small business. As time went on and we learned more about COVID on a weekly basis, the talk about wearing a mask shifted. Our friends were asking if we were going to sell masks in our store, and at first I said no. When we were able to open up our shop again, we gave our friends a choice to shop with us however they felt most comfortable. We even had a sign up that said, "We get it. Things are weird." And we want to accommodate and respect your comfort level and your preferred shopping experience. So, along with curbside pickup, free delivery in the Bemidji area, we also continued to sell our products online to meet our customers where they were with their COVID comfort level. Now, Bemidji is a community with a population of approximately 16,000, and in the surrounding area, there's about 50,000. It's also a favorite tourist destination, the home of Bemidji State University, and it acts as a hub for northern Minnesota. So there's lots of people traveling in and out of our community all year long, and as we started to learn more about how the virus spread, my views about masking began to change again. It wasn't until the COVID cases in our community started to rise dramatically in the last month that I started to consider mandating masks in our shop. Local businesses were closing their doors to allow employees to get tested, and that's when it really hit home for me. You see, our business isn't just a business, it's home. If you don't count sleeping, I probably spend more hours inside my business at Compass Rose than I do at my own house. We welcome hundreds of friends into our shop weekly from all over the world, and because of those friends, our customers, I'm in support of wearing a mask. We cannot afford to shut down for 2 weeks. We can't afford for our employees and their families to get sick. I love our town, and therefore the sacrifice to wear a mask is small in comparison to the risk of those around me. On Monday night, our hometown of Bemidji took the steps towards mandating masks in public areas. So today, I appreciate the support from the governor that helps protect small businesses like mine throughout the state. In a way, it helps level the playing field for businesses, and it really takes the pressure off of business owners like myself to not have to make that difficult decision. Our lives are a string of moments and connections. That's what makes the journey of life so grand. Our mission at Compass Rose is to provide goods that help to create a symbol or reminder of those memorable moments in our lives. The world doesn't need more stuff, but to fill the community with more experiences, connections, and joy through gift giving. I never thought I would say this, but face masks have now become a part of those life's moments. If wearing a mask can contribute to curbing the spread of COVID, I feel like it's a small price to pay to protect the business that I've worked so hard to build and for those that have helped me build it. Thank you for listening today, Minnesota. And Houston White will now share his story.
Hello, everyone. Lieutenant Governor, Governor Walz, man I consider a friend. I never imagined I'd live through a time like this. I've had some tough times in my life. I lost my wife, and I can only imagine what so many people throughout this world and throughout this country have experienced as a result of a pandemic, taking their loved ones, so I get it. Governor, I just want to extend a debt of gratitude for your leadership in this very difficult time in our state and our country. You know, as I said, I'm Houston White. I'm a kid from North Minneapolis. I own a barbershop, and for those of you who don't know, in the Black community, barbershop is like a sanctuary for some. It's a very important institution in our community. And I've grappled with when to open, how to open, because so many people come to the shop, not just for the transaction of a haircut, but to talk, to learn. As you said, it's a community space. And it's so important. And as much as I want to keep my business open, as much as I want to keep the revenue generating, I want to keep my neighbors and my community safe, and my staff also healthy and safe. You know, I understand, I get it. You know, every time I go to my aunt's house, I can't run up and hug her like I used to. I can't do some of the things that I used to do, and I get it. We all are going through a lot of that. But in this moment, I think we have to think about the collective consciousness, the collective health of us all. And you know, as hard as it was for me to get used to wearing this thing, if it's going to keep my mom and my community healthy, I'm going to do it. And so with that, you know, let's mask up, Minnesota, and keep each other safe. Thank you. Apologize. With that, Dr. Bacon.
I'm Dr. Leslie Bacon from North Memorial Health. As a doctor and infectious disease specialist, I'm encouraged and grateful that our state is adopting mandatory masking policy to prevent the spread of COVID-19. I can tell you from my experience as a healthcare worker at North Memorial Health that COVID-19 can be deadly to the elderly, to the frail, to the young adults, and even to children. It disproportionately affects Black, Indigenous, and people of color communities, as well as those with limited resources. That's my neighborhood. Using a mask in public, and particularly in closed spaces, will slow the spread of COVID-19. As Commissioner Malcolm referred to, a study performed at the University of Washington Institute for Health Metrics and Evaluation shows that if we can achieve high rates of mask use in public, we can dramatically drop new infections, hospitalizations, and even deaths. An example from this study shows that if masking in public is adopted by 95% of the time, we can potentially see a drop of 30% in COVID-related deaths. In the United States, that translates to 40,000 lives saved. That's a lot. One of the more unique aspects of COVID-19, however, is its ability to spread from one person who has COVID-19 infection but feels well to another. We may not know we are infected, and we can pass the infection along to another person. But obviously, somebody who is ill should stay isolated to protect others. But the possibility of spreading COVID-19 infection asymptomatically requires greater vigilance. It means that every one of us bears a responsibility to protect our community. By wearing masks when we are in public places, it will protect our essential workers, our co-workers, our families, and our neighbors. Masking is so very important and should not diminish the other potential spread of the virus by contact transmission. That means from the skin or secretions of one person to another. So masking should always be combined with the following practices: trying to stay away from people for at least 6 feet when possible. Use hand hygiene frequently. That means hand washing or the use of an ethanol alcohol-based hand rub. Avoid touching your face and hands. And finally, stay home and isolate yourself if ill to protect others. Thank you for allowing me to speak for my community and for healthcare workers and from the science. I would like to welcome Dr. Dimitri Deconia, Assistant Professor at the University of Minnesota, and my colleague.
Thank you. It's really great to be here. This is a hugely important topic, and I'm really thrilled to be here. As mentioned, my name is Dimitri Draconia. I'm also an infectious disease specialist. I'm an associate professor of medicine at the University of Minnesota. I want to say thanks to the governor and his team for taking this step. It is a step that really will make Minnesota safer, and for that, I'm really grateful. My normal job, I spend my time doing clinical care and clinical research, and so I spend most of my thinking about what evidence-based things can I do, and if I don't have that evidence, what can I do to get that evidence? And so I look at this debate about masking, is there evidence for it? And I've looked at it hard, and yes, there absolutely is evidence, and this is the right thing to do. I was really heartened to hear the Lieutenant Governor mention that there's nuance here. A cloth mask is certainly not good enough to go into a hospital and care for COVID patients. I wouldn't wear the mask that I wore coming into this room in the hospital. I would be wearing a medical grade mask with a face shield on top of it. But there are lots of things that are good but not perfect. Seatbelts and airbags, they work, but they do not always work. In infectious diseases, we stress prevention of infections, and one thing we talk about that's not so fun sometimes is talking about condoms. They also do not work all the time. But if everybody uses them, they have huge effects. So masking is really like that. They're not perfect, but they are certainly very good, and when you combine them with the other things that people have been mentioning, social distancing, staying home when ill, hand hygiene, all these things are easy, they're cheap, we really should be doing them, and I hope people will be doing them. I'm going to close by saying that uptake really is key. If everyone does this, we're going to be in great shape. Dr. Bacon and I have shared stories of when we're around out in the community and we see people not masking. It's sometimes tremendously disheartening to go back to work. My colleagues and I, we put in long hours, we're working on this, and when you go out in the community and you see people not masking and you realize, great, I get to go back to work tomorrow and keep trying to figure out how to fight this epidemic and seeing people not doing the bare minimum. I really hope that this mandate will help Minnesotans recognize that there is something they can do. It is relatively easy and straightforward, and I'm really hopeful they will take it up and really pull together and use their best collective action. And I think now we'll get back to the highlight of this, Governor Walz.
I think that's. I got 6 or 7 in my pocket. Minnesotans, we can do this. We put ourselves in a strong position. You've sacrificed greatly, as I said. These business owners have done that. We've got ourselves in a position where we have testing capacity, tracing capacity. We have flattened the curve. We've opened up most of our businesses. We are testing at a capacity of one of the highest in the country. We're putting data out there that is being used across the country to understand how we track this. We know more about this. We've reduced hospitalizations. We've protected our frontline workers. We've kept our children in daycare, and we're preparing to try and get our kids back in school. This is a small sacrifice for a potential big game. The upside of the mask wearing and the compliance is big, and we've made a lot of good decisions. We don't want to slide backwards. We don't want to get into that position. I, for one, am heartened yesterday by the president's first news conference in about 8 weeks on the coronavirus. Again, that acknowledgement that there's a tough road yet to go. The president is the one who said it is patriotic to wear a mask. He himself wore one. At this point in time, this is a pretty simple thing. And remember, if you're out walking your dog outside, you don't need to wear a mask if you're not around people. If you're talking to your neighbor across the fence while you're both mowing the yard, you can do that too. You're in your home, you don't have to do that. You're driving in the car by yourself, but you stop to go in for pay for gas and get a soda, just slip it on. That right there, if we do that at that compliance level, we're going to bottom this thing out and we're going to get to the other end of this. So I am grateful for the business owners who are here. I'm grateful for the health advice. I'm grateful for the collaboration. I think Steve Grove has been a pivot point for a lot of the businesses making sure they're being heard in this. And then, of course, the medical experts that are driving what it takes to get a handle on this. It feels like to me the seriousness is now being taken by the administration. We have a lot more tools than we had back in March. Couple that now with us stepping up in Minnesota. And again, when it comes to voting, Minnesotans vote higher than any other state. When it comes to filling out the census, we fill out the census better than any other state. We are good at doing good things for others when it comes to complying. Let's make the masks on that. Let's jet up that list of people who are wearing masks. And the great thing will be, is I can't tell you how grateful this will be, when Jan Malcolm gives her update on COVID, we're looking for that day when there are 0 deaths. We're looking for that day when we drop below 550 new cases down to double digits and then down to single digits. That's the goal. That's what the mask mandate does. That's the payoff at the end where we start to do those things that we want to do again. So grateful to all of you for being here. Glad to take questions. We'll start over here and then I'll move to the front with Esme.